On December 31st, 2021, University of Maryland Upper Chesapeake Health President and Chief Executive Officer Lyle E. Sheldon retired from his role as the leader and champion of healthcare for Harford County.
The word that comes to mind when I think about Lyle is legacy. What Lyle has built in the hospital and the way it's set up and the way it operates, the merger with the University of Maryland, what a compliment, what a tremendous benefit to our community that's going to go on for a very, very, very long time.
I have attended literally thousands of meetings at the hospital, and I've had thousands of interactions with Lyle Sheldon. And I can tell you right now that the best example of leadership is what I've seen from him over this period of time. He has led this organization during a period of significant changes, and his list of accomplishments is as long as my arm, and it's resulted in the best healthcare this community has ever had.
This has been quite a journey of 34 years, and when I think back in 1987, again, a community organization with a rich history of service at Hartford Memorial Hospital, and a recently not-for-profit hospital at Fallston General, sitting on 5 acres in Fallston with a gravel parking lot and trailers in the back, and to see what the Upper Chesapeake Medical Center facility looks like today, over 400,000 square feet on 50 acres, with a range of services that probably 35 years ago were just a twinkle in people's eyes. And so when we look at that rich history, we've seen access to care improve dramatically. We've seen the specialization of our physician services expand across so many different specialties, with over 600 physicians on our medical staff today. And who could ever think about the fundraising community philanthropic support that we've had, where we've raised over probably $50 to $60 million over that period of time for a whole host of capital campaigns, whether it was originally Upper Chesapeake Medical Center in 2000, or the Kaufman Cancer Center in 2013, the Senator Bob Hooper House, which opened 10 years ago, and then most recently the Klein Family Hartford Crisis Center. And so this community has just embraced Upper Chesapeake and embraced our services with their time, their talent, and their treasure in a way that I don't think anybody ever would have thought is possible.
One of Lyle's great attributes is his eye to the past, but also with one to the future. And I think about Lyle Sheldon as a community leader. I think about the team he put in place to hand off to a tremendously capable new CEO, Elizabeth Weiss, who has been engaging at all levels of our team members, our board, our community. And none of that would be possible without the foundation that Lyle put together. My prayer for Lyle is that he breathe, enjoy, and just take it all in. He has a wonderful family. He's done a lot for our community, and he's still a big part of our community.
So when I think of what I'm most proud of, I think first of all, being able to serve a community for 34 years, embraced by a community board of directors that has passion and roots go back 300 years, and a medical staff that is dynamic, capable, supportive, and actually a lot of fun to work with. And then a group of team members, over 3,300 team members that 75% of them live in Harford County. And you think of the impact that they have. And then our volunteers, our board's volunteers. We have over 1,000 volunteers at University of Maryland Upper Chesapeake Health. Again, just contributing to that rich history. Everybody I talked to said, take some time off, clear your head, reflect on your soul, and not make any commitments. But I didn't quite listen. What I decided to do is actually take a cross-country bicycle trip in the summer of 2022, coast to coast, about 4,000 miles. And we've actually labeled it Lyle's Miles for Mental Health. And as I've worked with colleagues over so many years, we've seen mental health issues that have been exacerbated during this pandemic. And I thought, what a better way than to take this opportunity as I'm traveling to actually raise funds on their behalf and contribute back to the community with dollars for mental health. My wife and I will retire here, and with our 3 generations of family here, and we hope that it's more. We really look forward to the continued growth and the continued development of this county.